with the African American Network, and we're focusing on our series of caring for the caregiver. And today is no different. We are focusing on a common problem that comes up with caregivers, but just from a different perspective. In this scenario, you're caring for individuals, and many of them may be independent, but then worrying about what's next and what will come. Sometimes, for many folks, that can create a scenario or a syndrome called burnout. And burnout is a real situation that affects everything from physicians to family members to caregivers to the whole team that's involved. Well, today we have what I'll call an expert, right, in focusing on not only burnout, but some of the potential complications from it. But hearing her story is going to be empowering, impactful, and engaging. And so I want to introduce to some and present to others Stephanie Anderson. How are you doing today?
I am doing great, and thank you for the invitation to appear on your series. I've been recommending a lot of people to view it, so the opportunity to come is a pleasure, so thank you.
Wonderful. No, and we talked a bit in the green room, and I know we don't have enough time to touch on everything, but tell us a little bit about yourself, and then we'll hop into this conversation, which I know is going to be wonderful.
Okay, so for brevity, my name is Stephanie Anderson. I have been in the beauty industry for 30 years, but in the latter part of that, I practice trichology and non-surgical hair replacement. So my ministry is to help those who are dealing with hair loss to be able to show up in the world that they want to with confidence. So that is pretty much what it is, because as we'll talk a little bit further, some people think it's vanity, but a lot of times people just need the support so they can show up a certain way in the world.
And hair loss, and as you can see, I'm not going to say, and you just start laughing. See, there you go. No, but I say that because a lot of times people just kind of put it off to the side.
Yes.
But at least as a cardiologist, we know that sometimes things that we think are simple can be harbingers of more significant items going on. And we'll touch on that a little bit later. Well, now I know this is caring for the caregiver, but tell us a little bit about your story. And it's a little different from a caregiver perspective, and how it had two phases where you were caring for people, caring for someone else, and then caring for the people that were caring for someone else.
Yes.
Talk a little bit about that.
So I have just been a fan of what you've been doing, but the opportunity to share that caregiving for caregivers can look different for everybody. What I would want the viewers to leave with, though, it's not an individual problem for one person that's caregiving. I believe it is a family issue, a community issue, and a society issue. So I'll just briefly share that as a much younger lady. My parents are now 92 and 94. My mom is 92. My dad is 94. But before that, my mother was caring for her aging parents. She was still working. And as a young adult, my siblings and I and my father just realized she was going to burn out without help. So we just, as a family, we decided to make sure that we were there for her as she was there for both of her parents, which for some years, they were able to live a great life with assistance from family. And eventually they did pass, but I still have my mom 30 years later.
Wow.
And my dad. So knowing that, she needed help, she wasn't going to ask for it, but we started taking shifts. And did just simple things just to relieve that burden. And so it's just a family thing. In the history with our culture normally, we used to live in one house and we'd help Big Mama, but we've gotten away from that.
Right.
So it just takes a little bit more effort to actually come and do and participate in a way that needs to be.
No, and I mean, and I call him my co-host, Mr. Williams. He would, interject that cultural component of our caregiving process, which every culture is different, but ours specifically is having that generational family, those multi-layers to, where the baby is cared for by the older member while the middle members go and work, and hearing you all still trying to be able to create that despite some of our geographic limitations and differences is beautiful. Now, one thing that you said that I, you all kind of noticed. Actually, your father knows. So what were some things that he noticed that maybe were some of the early signs of of burnout or fatigue that increased his concerns to ring the alarm, so to speak. Because I think
Yeah.
for a lot of people, when do we hit the panic button?
Yeah.
When do we ask for help? Because otherwise, like my mom used to say, a closed mouth don't get fed.
It
You know,
doesn't.
so we may get. So how do people know, or what were some of those early signs that you noticed?
So although it's been some time, I can't really pinpoint a specific.
Mm-hmm.
But I think, just like parents know their children,
Mm-hmm.
children know their parents, and
My goodness.
specifically spouses know each other.
Mm-hmm.
So it just was a situation of she was having to spend more time at her parents' home. She was afforded the opportunity to. They lived in a rural southeast Oklahoma. We lived in Oklahoma City at that time, and so we moved them to Oklahoma City. But she was spending a lot of time caring for them, doctor's appointments,
Mm-hmm.
different things, and sometimes even have to spend the night if there were situations that occurred. So we just collectively as a family, I can't really say, doctor, there was a specific, I can't pinpoint a specific,
Yeah.
but over time we realized that there was a necessity. And let me share this. My children are now grown, but my husband and I at the time, we had little ones, and I honestly believe that multi-layer of care started when I don't know nothing about daycare for my children because my parents were still working, but my grandparents, before they got older, were actually able to care for my children so I could go to work. And I really think that kind of adds to longevity, so it just was a full circle that we helped because they helped us, we're family, and that's just what was important for us.
No, I mean, and you keep highlighting these things that are just so powerful, right? Even though you couldn't identify a specific sign, you said that there were changes. You said
Yeah.
that the schedule, you said, because the three things in life that oftentimes get overlooked but are probably some of the most important are how much time you have to care for others, how much time you have to care for yourself, and how much time you have
Yes.
to build. You said, Dr. Bass, all of those are time, but they're all in different places and
True.
spaces. And if you're driving across town, if you're doing that, you really don't have time to disconnect and reconnect. And spouses, you identified are that barometer, right?
Yes.
If someone comes in and they normally say hello and now they went to hi, and it used to be a kiss and a hold of hand and now it's just a pat on the
Yeah.
back because they got to run and do this. Those are all things that I think we won't find a risk score in medicine,
Yeah.
but you know that risk is slowly trickling up. There was a course we took at my church called Experiencing God, and it talked about two components of that are important. The first one is having a relationship that's first real,
Yes.
right? And then having open communication so that it's personal, right? Because now don't get me wrong, I text all the time.
Yeah.
I like texting, but sometimes in a text, I don't get to see your face. I don't get to hear
Yes.
the strain in your voice. And so I think living in that community, building those conversations,
Yeah.
and really developing that relationship
Yeah.
that's both real and personal allowed you all to pick up on some of those things.
Yeah.
And so I guess for people watching, that maybe mama won't complain, or dad won't complain, how do you encourage them because of what you see to say, because sometimes you might want to help and they say, now don't overhelp, don't overstep. So how do you do that gracefully, so to
Yeah.
speak?
So thank you for pointing that out because it can all lead to burnout, which we were talking earlier. But what is difficult now, but I intentionally make it a part of my regimen. I'm here in San Antonio. My family's still in Oklahoma City. So every other month, I'm there. Now, although my parents are 92 and 94, they live independently. They're in good health. But still, we support them with anything they need. Now, sometimes we have to try to keep up with them. Even they're not picking up cell phones, and they say, "Girl, we grown." But it's that thing that you just have to make sure they're connected for anything that's
Right.
needed. But they don't ask for help, and that's the thing. So if you know people, you don't want to overhelp, just like you said, but you don't want to, because culturally, especially black women, we don't ask for help because we got the S on our chest and we can handle things.
Say that again. Say that again. You
I-
got an S on
I
your chest.
rip the S off.
You
I don't
ripped
have a
it.
problem with
Okay.
it. I really don't, because as a cardiologist, those different things can work with you in a medical level that cannot be repaired. So
Right.
I don't mind if I need it. I'm particular about who I ask for help,
Mm-hmm.
because you can't ask everybody. But
That's right.
those that I know that I can depend on, I don't mind. But going back to my parents, that they're at an age to where, thankfully, they're living independently.
Mm-hmm.
But it's just, I have a sibling left. We lost my brother a few years ago, but we make sure we have a thing that we have a thing that, since I'm not there, she's the custodial parent. I'm the
Mm-hmm.
non-custodial parent. So
Mm-hmm.
when I visit every other month, I'm checking on my boy and my girl. But we do it because it's a family thing, and we make sure that they're all we got when it comes
Mm-hmm.
to it. I'm married, she's married.
Mm.
But when it comes to those first five of us, parents and three children, we're what's left of that. And so they're very important to us. So we make sure that we're there for them. And even if they don't ask, we try to make sure that we're there. So even though I'm not caregiving for them now, I'm not, they're not caregivers at this point. But at that season that they were, you can still be a caregiver to the caregiver in that way.
Yeah, no, and I mean, and that's the beauty of the caregiving label, right?
Mm-hmm.
I think a lot of times we try to fit it in a box, but
Yeah.
if you are optimizing their digital interface, right?
Yes.
Mama, this is how you use your cell phone. Mama,
Yep.
this is how, like those things we don't think about,
Yeah.
but they add up, right?
Yeah.
Something I've been telling my patients, right? That
Mm-hmm.
come in and I can't remember my medicine. Why are you trying to remember? Just take a picture with your phone. Oh, you can do that? So it's
Yes.
those little
I
things
love
that
it.
that impact their health in
Yeah.
a way that really allows them to continue that longevity
Yes.
piece that we look at.
Yeah.
Now, we've touched on something and we've said the word, but really haven't, put a nice bow on it.
Okay.
Let's talk about burnout.
Uh-huh.
Let's talk about burnout and how you would kind of define that, and then we're going to touch on a condition that
Okay.
you focus on
Okay.
that maybe burnout may be one of the early progenitors of that problem. Talk
Yeah.
about burnout for us.
So burnout is one of those things that, especially when we talk about the African American community, I was just afforded the opportunity to speak at an amazing conference, the Central Texas African American Family Support Conference, in which burnout was one of the topics that they highlighted, because it looks different for different people. But for the most part, it is that moment that people are really going through the struggle, but they don't sometimes know how to ask for help, or they're getting situations that they don't understand why they're feeling a certain way, while they're reacting to normal situations differently than they were, because they're aggravated, they're, disappointed, they're rushed or whatever. So burnout, my definition, and I'll stay in my lane because I'm a
Oh,
trichologist and not a MD, but just the fact that a person is no longer in a place that they're used to being, and they know that they need help and maybe not able to, or they're not responding to things that they normally would. You have a person who normally is easygoing, but all of a sudden they're snapping at you, or even the fact that they're so overwhelmed. Burnout can be just overwhelmed.
Right.
They're doing so many things that they don't even know which way is up or what to do next, or just doing nothing can be burnout.
Yeah.
They've done so much that now they don't know which way is up. So it could just be so many things and show up for different people.
Yeah. No, and I like how you open it up, because I don't want to put a label on it, because I
Yeah.
think far too many people suffer from this
Yes.
and say, well, I'm not having this,
Those
this, and
symptoms.
this. Yeah.
Yeah.
And so because of that, one thing, it does enhance stress in the body. It does
Yes.
create some issue. And one
Yeah.
of the things we see with stress
Yeah.
is hair loss.
Definitely.
Remember when we talked a little earlier, we said,
Yeah.
well, how do you, the big thing there is, you said it's not about just vanity. It's about
definitely not.
well-being. It's about image. Talk about your work in the space of hair loss and how you live, and I'm going to say it,
Okay.
transform not only hearts, not only minds, but also trajectories of how
Yes.
people have moved forward. Because I know just your story is powerful. I mean, you made me want to sign up. Maybe so talk about the
I
hair loss
appreciate
and how you got into it and what that does. I know we don't have a ton of time, but I want to
Well,
hear it.
I will do it out in brevity, but I'm the alopecia advocate. And so what I do know that it is not just vanity. When people lose their hair, and a lot of times they focus on women, but a lot of men are concerned about losing hair as well. It is more than just something that you see visibly. when I started, especially after COVID, I think it helped me to do a deeper dive into the emotional and the mental aspect of it. But I started seeing people withdrawing. I started to see people really not navigating it, avoiding mirrors, avoiding cameras, dealing with things that I wouldn't necessarily think that they were. So I had to start studying it myself. So when it comes to appearance anxiety, which most of us have, I'm like, is my hair good today? Is this outfit, hiding what I needed to hide? Those are things that is very common. But there's a certain level that if a person's hair is thinning and they're preoccupied with it, they no longer want to go to church. They no longer want to be seen. Like I said, pictures are a real thing. Then it can morph into something much more real, much more devastating, and that's body dysmorphic disorder. So, like I said, I stay in my lane. I am not a therapist. However, I have a pipeline of professionals that when I start seeing certain things and I'm talking to people, I have people I can refer them to talk about it.
Wow. Now, I'm just curious, how did you get into that? How did you say, you know what, I'm going to advocate for this and make sure that I identify the resources and the strategies to help people with this, which I'll say is a silent condition, meaning, you won't feel hair loss, but the emotional impact is something that we see. And I'll interject this before, I have patients that some of the medicines I prescribe can contribute to hair loss. And it is, doc, I want to take care of my heart, but I'm feeling so down because of X that it's a tough, and I'm not equipped to do it. So how did you get into that space?
I will address how I got there, but let me assure you this, that to me, because I sell wigs, I sell cranial prosthetics. So my thing is, take your medicine. Because we want you whole.
Right.
I can help you get some hair. Because it may not ever grow back. And if it's something, I have a PDF. I have a reference where I can look up and I'm like, well, yeah, that medicine, a side effect is possibly thinning or hair loss. We want you healthy. So I will always advocate to take your medicine. So that I need you to know. And anybody who says otherwise is reckless. But how I got into this is I've always had my fondest memories revolve around hair, sitting on Saturday afternoons between my mama's legs, getting my hair pressed, me and my sister for church the next day.
See, I can smell the royal crown in
royal
the air.
Crown,
I can smell that in the air. I remember you. I didn't get much done, but I could smell it. Go ahead.
Those were, as I look back on it, those were some times to where it was good to be able to, my mom would talk to us about stuff that maybe, she had a captive audience. We had to make sure we didn't do too much protesting and hold that
Stop
ear
that
so we
move.
wouldn't get, But it was a beautiful experience that I believe is just helped me to develop. And the Lord gave me a skill and a passion to do hair. So 30 years later, into this, well, it's been about 30 years total, I started seeing people lose their hair. So I said, okay, it's a lot of stylists out here. There needs to be a specialist. So it just kind of manifested and grew from there. So, I take this more than a passion. It's a ministry for me to be able to help and to feed in, because I want people to feel good about themselves, regardless of what their outside appearance is. It starts internally.
Wow. Well, again, I'm excited just to see the continued work you're doing, and just proud to have the chance to meet you and talk to you about touching on subjects that, again, are tough to bring up. Now, I know people are wondering, how can they get in contact with you? How can they reach out? How can they do that? Where can they find you at?
So I'm social. So on social media, for the most part, it's going to be at the Alopecia Advocate. But my website is StephanieLAnderson.com.
Wonderful.
Thank you.
Well, Mrs. Anderson, thank you so much for coming by. And I know this won't be the last time.
Yes, I appreciate the opportunity.
No problem. Thank you. Well, this is Dr. Vatz with the African American Network, having another engaging discussion about caring for the caregiver. And as we talk today, it's not always a one-size-fits-all. Sometimes it's providing support outside of the traditional realm. That said, understanding that if we don't identify some of those subtle risks, some of those subtle issues, then burnout could be something that you see. In any case, developing a strategy that's both intentional, purposeful, and symptom-driven is something that we certainly can move forward to. Finally, subtle signs like hair loss and stress are all things that can be addressed if you approach it with the right strategy. Now, that said, we want you to enjoy what we're talking about. We want you to join us and also send us your request of different shows that you would like to see on the African American Network, understanding that we're here for you as you care for the caregiver. Thank you.